Hi there and welcome back. Well, according to the CDC, nearly 700 people die each and every year from heat-related illnesses. You know, some are just around the corner, and heat will, of course, be a major factor, as it is each and every year. Dr. Chris Wolcott with Urgent Care of Louisiana joins us this midday to talk more about heat-related illness. Dr. Wolcott, thanks so much for coming in.
Thank you for having me.
And although it's not too hot right now outside, it's never too early to start thinking about these illnesses that come with the extreme heat that we see here in the South. What exactly is a heat-related illness, first of all?
Heat-related illness is any condition, environment, or activity that the body will go through that the body starts to build up heat, and it builds up faster than it can dissipate, and it can cause damage to the body.
So what are the different types of heat-related illnesses, and how can we recognize them?
In general, there's 3 different stages. The first stage are just simply heat cramps.
Okay.
Athletes get them. You see them pull up the calf muscle or the hamstring muscles. These are some of the first signs that they might be getting dehydrated, electrolyte, sodium imbalances, painful muscles.
Yeah.
The second step is going to be heat exhaustion. This will be a more generalized fatigue accompanied with headaches, agitation, confusion sometimes, and just a generalized profound weakness.
Right.
The body temperature will typically go up in these patients, but not usually over 104. They typically will be profusely sweating.
Okay.
This is very dangerous. It's showing that the body has lost quite a bit of water, quite a bit of electrolytes. The last stage is a heat stroke, and this is a medical emergency.
Mm-hmm.
These people should show profound confusion, if not stroke-like symptoms, where lose control of body parts or maybe even become unconscious. They might throw up, complain of nausea, severe headaches, and the profound dehydration can lead to heart, kidney, liver failure, and it becomes a medical emergency quite quickly.
What can we do to make sure this doesn't happen to us?
One of the most important things is hydration. If you feel you're experiencing a heat injury or heat-related injury, you need to get out of the hot environment.
Yeah.
Air conditioning, but even just getting into shade can help. Drinking a cool drink, whether it be a sports drink or water, wrapping yourself in a wet sheet and having a fan blow on you. These are techniques we use in the emergency room and at the urgent care. If you get to a point where you're throwing up or not able to keep water or sports drinks down, you might need an IV, and that can be done. We can rehydrate you and keep you cool that way. One of the most important things is prevention.
Yeah.
When you anticipate an activity that's going to be in the heat, where you're going to do some sweating, you need to make sure you're hydrated. And we actually use a term called pre-hydration.
Right.
And some people advocate actually pre-hydrating the night before. You start drinking water, start drinking sports drinks.
Yeah.
You might have to get up a few times throughout the night.
Of course.
But when you wake up in the morning, you continue. And then you continue through the activity to drink water and sports drinks. And it is important to do water and
a little bit both of them.
For the electrolytes.
I want to talk a whole lot more about this because this is a really important topic in just a few moments. Dr. Wolcott will be sticking around after this newscast to answer all of your questions about heat-related illnesses during the live webcast. You can join in on that discussion by simply heading over to our website, ktbs.com. When you get there, just scroll down, click on that orange Healthline 3 box right there on the right side of your screen. That's going to take you to our webcast, which streams live. You can watch the webcast right there. You can also submit your questions right there at ktbs.com. If you don't have internet, don't worry, we've got you covered. You can always give us a call during the show with your questions, 318-219-4569. You can also watch the show on our digital channel 3.3. We hope you'll join us for Healthline 3 at noon following this newscast. We're coming right back.